Hi, hello, Hruta Durgule here, and I have this question. So the question is like you have been married for 2 years now. So when are you having your kid? And so the thing is, like any other woman, like any other girl, even I am going through that struggle where my career clock and the biological clock are not going hand in hand. But then I have come across this term called egg freezing. And being the kind of person I am, I've been very curious about this thing. And finally, I have Dr. Nilesh who's going to help me and us actually understand what exactly is egg freezing.
So egg freezing or social freezing, what we call it as. So it is freezing of your gametes, that is eggs in women, for non-medical conditions. If you want to call it as a social freezing, it's not perfectly non-medical. I would call it as preventive medical because it's necessary. So it's like you just take out your eggs and freeze those so that you can utilize them later on in your life when you want to get pregnant. Probably that time where your fertility may go down. So that's an anticipation and a response to that anticipation. I would equate it like to take a vaccine. Vaccine has been an important part of our lives. So many of the vaccines we are taking in the childhood just to prevent adult onset diseases. Similarly, on the same grounds, fertility preservation or egg freezing or social freezing would be like it's a preventive thing where you would preserve your fertility for your future. And it would be also an important thing for those women who are suffering from certain medical disorders or maybe some serious disorders to preserve their fertility. Right now, I would say, just like to highlight the impact of this, is that maybe only one or two patients coming in my OPD are coming for social freezing. Okay, that's the meager number or very small number which is there, but it has a huge scope, and many women should go for social freezing because the careers are changing. Everybody is into their profession, careers, then maybe athletes. All these people are around us, and they want to focus on their career first. But as you said in your first sentence, the biological clock doesn't stop for anybody, and therefore there lies the importance of social freezing.
So, Dr. Nilesh, you just told us about egg freezing, but I've read something called as social freezing. What exactly is the difference, like egg freezing and social freezing?
When we are freezing the gametes, and that's for medical reasons, we call it as egg freezing. But a healthy woman who is fertile enough and freezing it just want to delay in the pregnancy, that will be termed as social freezing.
Social freezing. But how do I know that egg freezing is for me?
The biological clock which we talked about is constantly ticking, and we know that fertile woman is going to be remain fertile for around her reproductive lifespan, which ranges from around 15 to 45 years of age. But the fertility is going to drop, and the fertility drop is around 35 years of age for a woman. And this biological clock in Indian women has started decreasing, and the fertility is dropping at around 32 or maybe 30 for some. So we need to understand that and respect that biological clock. And therefore, if you are going to plan or delay your pregnancy, or if you want to delay your pregnancy for some medical grounds, maybe for your career sake, in those cases you want to and you should be thinking about social freezing or egg freezing.
I get it, but now I have a really, a very common question, I would say. Is it painful?
It's a very simple procedure which would just require 14 days or 15 days of your life, and you will be able to freeze your eggs. And it's done by do a ovarian stimulation, then we do go for the oocyte retrieval, and then we go for the cryopreservation and the storage part. And the second part is where we utilize the eggs later on. In all this process, you receive very small injections which are least painful. These are not like normal injections. And a monitoring that is done on ultrasound, and the part of the egg retrieval is done under anesthesia, so it's least painful or not painful. Yeah.
So, what do you think is the right age to freeze the eggs?
As in Indian females, we talked about the age of menarche or the achieving of menses is dropping, and we have young girls as young as 9 years or 10 years of their age having menarche, and that's why the reproductive lifespan is not going to be longer enough. Your fertility is going to drop soon, and therefore at 35 if you are thinking about dropping in the fertility, and for Indian females it's 32, the ideal age would be around 25. But there is nothing ideal for everyone. They can't plan at 25, but I would say somewhere between 21 when you are an adult enough to around 30 would be a good age to store your eggs so that your eggs are very young and they remain young because we are cryopreserving them.
At the age of 21 or 22, we don't even know what you want to do in our life, leave alone if we want a child or no. So I think the main awareness should be, you know, should be done, I think, in front of the parents maybe, because it's a very good call for them to take for their daughter. What do you think about that? Like, because there are a lot of times where a 21-year-old or 25-year-old is not that financially independent. And in our society, everything zero downs to finance. Like, we can't ignore, it's one of the very important factor. Like, this all is very nice, but can we afford it? So what do you think about that, and what would you like to say about that?
Yeah, I think I got two questions out of this.
Yeah.
One was regarding whether how should we do the counseling part and
Yeah.
how should we make public aware.
Yeah.
And the second part was regarding the finances, what would be, how to handle that. Basically, the first part is regarding awareness of the public regarding social freezing. The Hruta Durgule doing this event probably would be the start of this movement called as social freezing, and this will be definitely helpful for young girls to plan their future. And this awareness can be brought up from the social media, maybe through television campaigns, maybe through fertility centers like us talking more about that. It's going to be like maybe vaccination, which is important, so it's going to be more important like that. Since we are seeing patients with decreasing fertility over years, we are seeing men and women losing their fertility quite soon. And there lies the importance of this awareness. This can be done at multiple platforms, maybe the parents being educated, maybe at a college level when they are adults, like women usually are considered adults after 18, so at that time, or maybe once they are entering into their professional journey, like their first job.
Yeah.
This awareness can be brought at these multiple levels, and I think that needs to be highlighted.
Yeah, so like,
Yeah.
I think I can mention this topic, like, Apple and Facebook.
Yeah.
They have,
Yeah.
like, for the female employees, they have this, they give specific amount for egg freezing, right?
Absolutely.
Like an insurance. So do
Absolutely.
you think we should do something like this? Because, yeah, I think if it's a good thing, because I feel it's like a ray of hope for females or women like me, working women like me, who are really constantly battling, whether to follow the career clock or, surrender to the biological clock.
This movement of egg freezing hasn't picked up quite well. Probably it will pick up from now onwards. But it started once Apple and Facebook announced insurance coverage for their employees, around 40 to 50% coverage of the egg freezing package. And that was a momentum. It received some positives, it received some negatives from it, always has so. But we need to take the positives from it because it initiated the process. Regarding the finances, I would say government should be kind enough to give finances or maybe insure this under the insurance, the egg freezing part. As a fertility center and as a social thing, when it comes to our own center, probably we have channelized those things. And, even if it's a young female who is dependent on their parents, they can also afford this.
But how do I know if egg freezing is for me? Or like, who can consider it?
So actually, it's not basically the who, it's we should understand it, the why of it. So egg freezing is for young females who are career oriented, who have focus and who want life in their control. Persons like you who are into the industry, and those who are in athletes, those who have entered their startups, who want to set a life, achieve something, and then go for childbearing part of it.
Basically, who wants to take charge of the biological clock?
Yes,
You can say
absolutely,
that.
yeah. So those who want to take charge of their life and also take charge of their biological clock. This is going to help them in the larger term, in the longer life. The basic instinct, the motherly instinct is not going to go. So maybe after they have achieved everything in their life and now they want to focus on their family, and if they have their eggs frozen previously, this is going to help them in a big way.
If I'm a 21-year-old and 21 to 30, like you said, is like the correct age for egg freezing. But what if anybody has a specific medical condition?
Probably women who have medical conditions which are chronic medical conditions like autoimmune conditions, which is going to affect their whole body, their gametes. This is going to affect their fertility in future. Cancer, specifically cancer per se, can also affect the gametes, or maybe the treatments for cancer like chemotherapy, radiotherapy. These can also affect the egg count and the gametes.
Okay.
Probably other gynecological conditions are there, like endometriosis, where you have blood cysts in the ovaries, or where genetic disorders like Turner mosaics, or maybe fragile X syndrome, where there is problem with the X chromosome, and that's why there will be a premature ovarian insufficiency, or maybe the ovaries will start their functioning of ovaries will be going down. Then there are conditions like cancer, where cancer per se, or maybe the treatments for cancer like chemotherapy or radiotherapy is going to affect your gametes, and this is going to cause a irreversible damage with your gametes, so you can't reverse the process again. Then there are certain conditions which are genetic disorders which affect your X chromosome, like Turner mosaics, or maybe fragile X syndrome. These conditions are like from your birth, your genes are like that, and this is going to cause a decrease in the ovarian function very early. So there will be premature ovarian insufficiency, where the ovarian function drops to zero below before you are 30. So if we recognize that earlier, so sooner the better we go for egg freezing. So these are certain conditions where we can help the woman. Certain other gynecological conditions are also there, like endometriosis or poor ovarian reserve. If we diagnose these early, then we can go for egg freezing, and future problems can be prevented.
Right. So it's like a ray of hope. It's like a boon.
Yes.
But like you said about cancer, so what do you suggest that when can a cancer patient have a baby? Like once the cancer is cured,
Yeah.
what is like the suggested time when you can have the baby?
So cancer patients usually, now many of the cancers are curable.
Yeah.
Initially, it was thought, once cancer, you can't get out of it and maybe you lose life. But the life expectancy with cancer patients has increased because of newer and newer medicines, chemotherapy, radiotherapy. There is something called as immunotherapy which has come up. Cancer specialist friends are helping women or helping patients in that. But we need to understand that once a woman is free of cancer, she'll also come back to her natural routine life,
Yes.
and will also start expecting or have the natural feeling of becoming a mother.
Yeah.
So that time probably we can't help her if she hasn't preserved her eggs, because the chemotherapy, radiotherapy and the immunotherapy all may damage her gametes, and therefore the cryopreservation or the egg freezing was very important. So
Sorry, what is cryopreservation?
yeah, so I just use some medical words.
Yeah.
So cryopreservation, good you asked me what is cryopreservation, because we are just talking about egg freezing and social freezing.
Yeah.
But the medical part of it is cryopreservation, where we do the rapid freezing of these eggs. So these gametes are withdrawn, the eggs are taken outside, we analyze them under the microscope, and whichever are good eggs are selected, and we just freeze them by a rapid freezing process, where the liquid nitrogen is used, and there are some agents or media is used, in which the eggs are suspended, and then they are taken into the liquid nitrogen, which is minus 196 degrees Celsius. At that temperature, the cells will remain as they are, but the metabolic activities of the cells will stop. So cells won't grow.
Oh, okay.
And that's how we preserve fertility. And similarly, eggs can be preserved, then embryos can be preserved, even sperms can be preserved.
So that's how the storage of the eggs works, right?
That's right.
In very layman's language,
Absolutely. Yes,
correct?
yes. This was about cryopreservation, and this cryopreservation is going to help all these cancer patients. And you asked me about when should they conceive.
Yeah.
So probably once they are free of cancer, one thing. Secondly, once they have stopped their cancer treatments like chemotherapy, immunotherapy, because this is potentially going to damage their embryo or maybe cause problems with their pregnancy. So once they are free of that, only those medications which are useful for them for their survival, only those medications are on, and all the potentially toxic medications are gone for the cancer treatment. That is the time when they can conceive.
How many eggs need to be taken?
Yeah.
Am I sounding like really very, but it's like very common questions. I'm sure.
I think so. It's a very practical question.
Yeah.
The safety of the procedure, then how long we can store it, and how many eggs. So basically, it's a very safe technique now, because we have been storing embryos. Egg freezing has been accredited and approved as a treatment since 2013, when the American Society of Reproductive Medicine told that it's no longer an experimental treatment, it's a validated treatment. Once we validate a treatment, then all the safety has already been studied. So the eggs remain as they are for months to years. You can freeze eggs for years together.
Okay.
like 10 years, 15 years, 20 years. They can be frozen as longer they are in the liquid nitrogen, and you respect that there is no loss of that liquid nitrogen. Secondly, you can be positive that whatever eggs you have stored, almost 90 to 95% can be retrieved back well. So that's a very good part of it.
Okay.
And the third part was regarding how many eggs. Basically, for preparing a good embryo, we would sufficiently require around more than 10 eggs, and mostly in one stimulation which we carry on for egg retrieval. We usually get that eggs if the egg reserve is good.
So what do you think, what are the factors affecting the success rate?
So if we consider about the success rate of egg freezing, the final success rate, so there are certain factors. One of those is age, the second is your body mass index, third is your ovarian reserve, and maybe other factors like medical conditions, if you have any medical conditions. If you talk about egg reserve or ovarian reserve, it's the number of eggs present in your ovary at this moment of time. This is very important to understand. It's a very simple test. You can just go get your blood test done, or you can just go to the gynecologist or fertility specialist, get your sonography done, and you'll know your ovarian reserve. This is very important to understand because if your egg reserve is dropping, you'll not be able to feel any symptoms. So if your egg reserve is a good reserve, which we consider as AMH levels somewhere between 1.8 to 3.5, and your antral follicle count is a good antral follicle count somewhere between 10 to 20, you are good enough to go for egg freezing, and that will give you good outcomes also.
How long exactly this process takes?
Yeah, this is not a very longer process, but initial consultation is important. So you just walk in a fertility clinic where you have cryopreservation facilities. So selecting a clinic is also important. Yeah. You have your first consultation. You understand all these parameters, the success rate, the procedure, what is going to be the second step, when are you going to go for the second step. All these you need to understand first, okay? And after this first consultation, you will be asked to do certain tests. And along with that, certain other tests like your routine test for undergoing that minor procedure of egg pickup. So all this will be done in your first consultation. Then the actual procedure might be started on day 2 of your cycle, where we start with some small injections called as ovarian stimulation. And after we decide that this is sufficient enough stimulation, then we go for the trigger part. And 36 hours after that trigger injection, we do the oocyte retrieval part, which is a small procedure which is under small anesthesia. This is a 15 to 20 minutes, very small procedure, and on the same day you can walk off to your home. Okay. And this total duration of this start to end of this stimulation to the ovum pickup is around 14 days.
Any side effects like before taking the process or after doing the treatment?
No major side effects in this procedure because it's a completely monitored procedure. Okay, some minor side effects can be expected in women who have a higher reserve, like PCOD patients, where you have a very high reserve and they are going to get hyperstimulated. So the number of eggs which we retrieve are going to be a little higher number. So in these patients, if we keep the injections to a lower extent and the triggers which are chosen wisely, and certain other additional things which are advised to the patient, like high protein diet and having a good liquid intake, all this is going to help. And we are now a OHSS free clinic. Oasis Fertility is a OHSS free clinic. We don't have complications related to hyperstimulation because we take all these precautions. So no major side effects. Some minor side effects or minor changes which you might notice during this procedure is some amount of heaviness in your body, some amount of mood swings, or breast heaviness, which you call as mastalgia. So these certain minor subtle changes you might notice in your body because of some hormonal changes. But all this get reversed once we stop those injections, and you're back to your normal, and you can resume your duties maybe second or third day after the oocyte.
I was just going to ask you, how soon can we just get back to work?
Yeah.
So basically you need 14 days with consultation or without consultation?
First consultation is a separate procedure.
Yeah, so the whole process takes 14 days.
14 days, yeah. And you can get back to your work maybe even the second day of your oocyte retrieval, or maybe the third day. You can take rest for one day.
High protein diet and water intake. Yeah. So what if I decide to, I've decided that I want to freeze my eggs, but I have a certain lifestyle, right? Would you suggest some lifestyle changes where, if you have decided now that no, you want to do egg freezing, but there are basic lifestyle changes you need to make. So what would you, can you suggest something?
So this lifestyle changes would be recommended for those who don't have any medical conditions, because if you
Yeah.
have certain medical conditions, we need to go immediately. Then we don't need to stop. Lifestyle changes have to be adopted for at least 2 to 3 months before there can be certain changes in your egg quality, because that is the normal duration for egg formation, which is around more than 2 months, so 2 to 2.5 months. So you have to follow a healthy lifestyle. The diet should be restricted in fast foods. You should have more of proteins. You should have less of simple carbohydrates and more of antioxidant rich foods like fruits, salads, then uh, curd, buttermilk, and this nuts will give you lots of antioxidants, and maybe some form of exercise, an active exercise for around 45 minutes a day, at least 5 days a week would be definitely useful. Boost your gametes.
Yeah.
Having healthy gametes, that will help you.
Okay.
And of course, staying away from addictions and getting a good sleep. These are also two very important factors.
Sleep is like a solution to a lot of things. And also, if I may ask, what is like the success rate for Oasis when it comes to egg freezing?
We are very competitive about that. We need to have our standards set. We always present our data to the European Society of Human Reproduction and Embryology, that is ESHRE. We also present our data in the international conferences like the ASRM. We have been quite competitive, and our success rates per se in IVF, where we utilize those eggs later on, is to the tune of around 60 to 70%, which is quite competitive when we consider internationally.
That is so good. And also, any specific cities that you want to target to, or you're targeting, and from where are you getting really good response, or there's a lot of awareness? What do you think? Which city that is?
Yeah, usually the metros, Bombay, Bangalore, then Hyderabad, Delhi, and the other metros, which are upcoming metros like Pune, okay, and Kolkata. All these are cities which we are highlighting right now. Presence of Oasis Pan Maharashtra first started in Pune, so probably we'll like to initiate that movement from here onwards.
It would be great.
Yeah.
Yeah. You explained us what exactly is egg freezing, right? So I want to ask you the next step, and that is what are the financial implications of egg freezing? Like, how much does the process cost? Can you just give us some idea about it?
This is going to cost you less than an IVF cycle. The cost of IVF cycle in different cities at different centers will have different costs, but this is definitely going to cost you less, and this is going to decrease the future cost also. So if you avail the same IVF cycle later on 10 years after, and you try to prepare eggs, that is going to cost you more, because probably the injections used will be more and the complications will be more. So this is going to save your cost in that perspective also. Once we come to the cost, the cost incurred is not too much, and it should not be considered as expenses. We should consider this as an investment in future. The IVF costs which are there, it's going to cost you less than an IVF cycle. Probably in different cities at different centers, it will have different costs. So the cost would range from somewhere 1.2 to around 1.5 lakh in a smaller city or a good setup, 2 to 2.5 lakhs for it would include the first process of egg retrieval and everything, and also include the yearly cost which is incurred for the preservation of the eggs, for how many number of eggs years you want. Patients don't need to take a burden of the cost, because we have facilities of no cost EMI where they don't have to pay any interest, and they can just pay it in an installment part for 1 year or 2 years, whatever they wish to.
Right. Yeah. But it's covered under like insurance?
As of now in India, government doesn't cover health under insurance. The government insurance is not there. Everybody has to buy their own insurance. So right now this is not included in the general insurance. But yeah, corporate companies and the insurance companies should take this up as a priority, because this would definitely be helpful for all the upcoming girls who want to pursue their career and then plan a pregnancy later on.
Definitely, yeah. It would be a great part of an awareness campaign. Yeah, because awareness is needed. It's like, when you hear words like IVF or egg freezing, they're like really big words. Like before coming here, I knew nothing about it. But I had no clue ki what exactly it was. But it's like, it's when you start knowing things, ki, okay, it's not that hard. Okay, I can do this. So I think awareness is needed.
Yeah, it has to be done. The message has to be passed till the grassroots level. But the social media campaigns and television campaigns, then reaching out to masses, probably catching girls when they are young, at their schools, colleges, when they are entering the journey of adulthood. And that is the time where we can catch them, tell their parents, counsel them, and tell the importance of this procedure, and also highlight less side effect profile or maybe no future side effects. All this can be highlighted, and any negatives about it can be discussed. All this can be done, and in a good way we could reach the masses at large.
You've told us what egg freezing is. Also, you've told us the financial aspect of it. Is it ethical?
Basically, these questions would arise. Is it ethical?
Yeah.
I think once it comes to ethics, I would consider medical ethics about anything else. Health is important. So once we are taken the medical oath or the Hippocrates oath in our MBBS days, we always pray or we always tell while taking the oath that do no harm. So it is absolutely ethical. We are doing this for preservation of fertility, and it's not going to harm in any way the patient. There is not going to be any short-term or any long-term side effect profile. This is going to definitely be helpful, and it's definitely will be considered ethically on a medical background, on a humanitarian background as well. Other aspects of it would be maybe religious.
Yeah.
We should think beyond religion. I'm happy that we are practicing. I'm practicing in India, where all religions are accepting the newer advances of science wholeheartedly. Once it comes to social freezing, it's just a part of IVF. It's just a sub part of it.
Yeah.
So I don't think so that will be any religious problems while considering this.
And what do you think about the legal aspect?
Legally, I feel so. Now the laws have come up, which are pertaining to ART center, and they consciously guide us, and there is no problem, while doing this egg freezing. May it be for medical grounds or may be it for social freezing. It's completely safe legally.
So we have been speaking about egg freezing process for a really long time now. So I know you can't mention names, but can you share some inspirational stories or your experiences?
Yeah, I know I can't mention names, but all these stories come up to my mind, all as like incidences. There is a boy who comes with his sister, and she was a cancer patient diagnosed as a cancer at around 21 years of age, too tender age or maybe just entering her adulthood. And all the family was depressed, but that boy was a young boy, but he was futuristic, and he read about everything and cancer treatments, and he could figure it out that my sister is going to survive out of cancer, and probably she can think of her life ahead. She may get married and she may have children in the future. So why not freeze her eggs? And he came to know about egg freezing on the internet. He came to me for the future counseling, and we could go through her history of cancer. We could analyze, we could talk with the oncologist, and we could figure it out that we can take out this 14 days of her treatment part and just do the egg retrieval and freeze her eggs before she undergoes the first cycle of chemotherapy, which is going to damage her eggs. So this is how we got her egg frozen. Probably she'll complete her treatment and come back to us.
Yes, I'm sure.
Yeah.
Yes.
So this is one case which gives us immense satisfaction. So another woman which I could remember is a 26-year-old new entrepreneur, or the new millennium we can say. These are striving for their own settlement and to prove themselves, to prove a mark in life. She's a IITian, and she wanted to have focus on her career. She has just started a new setup, and first 5 years of hers are going to be a domestic setup, and then 5 years post that would be an international setup. So her 10 years of life is already planned, and she doesn't have time for her marriage and her childbearing till then.
Yeah.
She's already 26, and probably she's thinking, my fertility will be lost.
Yeah.
And she comes to me with her boyfriend, who is probably going to be her husband later on. But they have decided that they'll postpone their marriage till they settle, and probably they'll postpone their childbearing for 10 years down the line. Therefore, I spoke to them, and I offered them an option of checking their ovarian reserve, which was perfectly fine, and then we decided to go for egg freezing. And since her age, she's young, 26, and her egg reserve is also quite good, we could freeze her eggs and in a good condition right now, probably 10 years down the line, because this doesn't have any limitation. We can freeze eggs for as long as 10 years, 15 years, and therefore she can come back to us and get her second step completed, which will be IVF and conception.
Nice. Finally, okay, I decide that I want to go for egg freezing, right? But it's always said that it's very difficult to find a good doctor or a good clinic. How do I zero down that okay, this is the best clinic where I can trust completely and I can just go for it?
First of all, the clinician's experience does matter when it comes to good egg freezing protocol, because there is going to be a different protocol for social freezing. In cancer freezing, we have random start protocol. So, coming down to a good clinician who has that ample experience with fertility and egg freezing is a first important thing. Second thing would be the cryopreservation facilities and the techniques for cryopreservation. This continuous maintenance of the lab equipment in the same standards. So we have class 10,000 lab where we follow all the standards, which are followed internationally. So this is very important. So ensuring that is important. And the inner intricacies of the lab, this can be analyzed. Once you walk down in a center, you can see to yourself, what the center is functioning like, and you can have a chat with your doctors regarding the facilities, core facilities, the second follow-up, the IVF facilities, their success rates, transparency, ethicalness of practice. All this is going to matter.
Okay.
Yeah.
Thank you so much, sir. You have been very transparent with your answers, and I too have come to a conclusion that yes, I will be considering egg freezing, and I am sure this video has helped you with a lot of information. And if you're really thinking that you need to take charge of your biological clock, then you should consider egg freezing. At least go and meet fertility expert and then decide and take the first step. Thank you.